What if one simple test could quietly show whether you stay independent or slowly lose it? Have you ever noticed that standing up from a chair feels harder than before? Maybe you stop for a moment. Maybe you push with your hands. Maybe you tell yourself it is just age. But for many people over 80, failing the 10-second test is the moment life starts to feel smaller. Movements become careful, confidence slowly disappears, and fear begins to grow. But what if just 3 simple exercises could help you take control again and protect your future? In this video, you will learn what the 10-second test really means, why doctors and researchers care about it, and how 3 simple exercises can rebuild strength, balance, and confidence, even later in life. We will explain the science in a very easy way, show how to do each exercise safely, explain who should do them and who should be careful, and show how small daily effort can create big change over time. If you want to live healthy and strong after 40, 50, 60, and beyond, subscribe to this channel now and support content made for real people, not athletes. Also, tell us your age and where you are watching from in the comments. We read and reply to every comment. Now let us begin. The 10-second test looks simple, but it tells us something very important. It often means the sit-to-stand test, where a person is asked to stand up from a chair several times in 10 seconds, or stand up once without using their hands. Research shows that having trouble with this movement is closely linked to weak legs, poor balance, higher risk of falling, and loss of independence. In older adults, standing up from a chair is not just one muscle working. It requires the thighs, hips, stomach muscles, and the brain to work together. When this movement becomes slow or shaky, it usually means muscle strength and power are decreasing. This condition is called muscle loss with aging. It happens naturally as we get older, but it gets worse when we stop moving. Studies show that adults over 60 who struggle to stand from a chair are more likely to have walking and movement problems within a few years. This does not mean decline is certain. It means the body is giving a warning, and warnings give us a chance to act. Doctors recommend simple exercises because they truly work when done regularly. The first exercise is the chair sit to stand. This exercise directly trains the same movement as the test. Sit on a strong chair with your feet flat on the floor and about shoulder width apart. Your knees should point forward, not inward. If you can, cross your arms over your chest. Slowly lean forward a little and stand up, using your legs. Pause for 1 second at the top, then slowly sit back down. With control. Research shows that moving slowly makes the muscles work better and protects the joints. Beginners can start with 2 sets of 5 to 8 repetitions, resting 1 to 2 minutes between sets. If this feels too hard, it is okay to use your hands lightly on the chair at first. Progress happens when you can do 10 to 12 repetitions without using your hands. This exercise is safe for most adults over 40, including people in their 70s and 80s. Anyone with strong knee pain, recent surgery, or serious joint problems should talk to a professional first. The first change most people notice is confidence. Standing up feels normal again, instead of difficult. When this movement is avoided, weakness increases and dependence grows. The second exercise focuses on balance, because strength alone is not enough. Poor balance leads to falls. Falls are one of the main causes of injury in adults over 65. Balance training greatly reduces this risk. The exercise is the single leg stand with support. Stand near a wall or chair so you can hold it. If needed, place one hand lightly on the support. Shift your weight onto one leg and lift the other foot a few inches off the floor. Hold this position while breathing normally. Try to hold for 10 to 20 seconds on each side. Repeat 2 to 3 times with short rest. Research shows that even short balance holds improve how the brain and muscles work together. If this feels easy, you can use less hand support or slowly increase the time. This exercise is safe for most older adults, even those who feel unsteady. People with strong dizziness or nerve conditions should move carefully. Emotionally, many people feel relief. The fear of falling slowly fades. When balance is ignored, the body becomes stiff, which actually increases fall risk. The third exercise builds leg endurance. This helps with walking, climbing stairs, and daily tasks. Doctors often recommend supported step backs because they strengthen the legs without putting too much stress on the joints. Stand behind a chair and hold the back for support. Step 1 foot back and gently bend both knees a little, keeping your body upright. Then return to standing and switch sides. Do 2 sets of 6 to 8 repetitions per leg, resting 1 minute. Between sets, research shows that slow and controlled leg movements improve muscle endurance and joint stability in older adults. This exercise is good for people who can stand comfortably and want stronger legs. For walking, people with strong hip or knee pain should keep the movement small or skip this exercise. Over time, people feel steadier during longer walks and notice less leg tiredness. When leg endurance is ignored, daily tasks become exhausting, and people start avoiding movement, which speeds up decline. The science behind these exercises is clear. Studies show that strength and balance training 2 to 3 times per week can slow or even partly reverse muscle loss from aging, improve movement, and increase quality of life. This is not about becoming young again. It is about keeping your ability to live independently. Before starting these exercises, many people describe their days as careful and limited. They sit longer than they want, avoid stairs, worry about falling, need help standing, and feel older than their age. After weeks of steady practice, the change is quiet, but powerful. Standing up becomes smoother, walking feels more stable, confidence returns, and independence feels possible again. The change is not only physical, but emotional. The fear in the background becomes quieter. The body starts to feel reliable again. Failing the 10-second test does not mean the end of independence. It means the beginning of awareness. Small actions done every day can shape how you age. Simple exercises work because they respect aging bodies, while still helping them grow stronger. If you want to stay strong as you get older, remember this: movement is not punishment. Movement is permission to keep living fully. Start where you are, be patient with yourself, and choose to invest in your future body today. If this video helped you understand your body better, subscribe for more trusted and easy guidance. Share your age and story in the comments. And remember, strength at any age is built one small step at a time.